So welcome everyone to today's Share and Learn on planning for National Children's Dental Health Month. My name's Aubrey COHTAC. I'm one of the COHTAC team members, and we have a couple of really great presenters today. I'm going to go over just a couple of housekeeping things. So this meeting is being recorded. All of our Share and Learns are recorded and posted on our YouTube channel afterwards, and we'll post them on our site as well and send it in a follow-up email to everyone who registered today. If you have questions, which we welcome, please drop them into the chat box. We will keep track of them throughout the meeting and we'll have time and space to answer them. So anytime anything comes up, drop it in the chat line and I'll keep track of them. So besides questions, comments, resource sharing, and other discussion are absolutely welcome in the chat. So feel free to join in there. And then toward the end, we will have an evaluation poll and a survey where you can send some of your thoughts to us. And we'd really appreciate you taking the extra couple of minutes just to send some feedback for us. Okay, so moving on to today's agenda. So the learning objectives were in the Zoom registration. So hopefully you got a chance to see that. But how we're going to meet those objectives is by going over some existing resources that are already on the COHTAC website. And then I'm going to pass it over to Smile California to share what they have in store. And that'll be Elizabeth Navarro. And then we're going to turn it over to Matt Jacob, who is going to say, now that you know where to find a lot of these resources, how can you use them effectively and how can you leverage this window of opportunity, which is National Children's Dental Health Month, to highlight and showcase what you all are working on for children's oral health. We'll pause for some questions and then we're going to go into some small group discussion in breakout rooms, assuming Zoom works with us today. So I'm super excited about that as well. All right, so moving on, I am going to do a quick overview of what you can find on the COHTAC website right now. So I'm going to drop our link into the chat so you can follow along if you'd like to. But I'm just going to navigate to a few sources before I pass it off to Smile California. So this is the COHTAC homepage, and there's just a couple of things that I want to show specifically for National Children's Dental Health Month, and that is our oral health education resources page. So it's under resources, oral health education resources. And this is chock full of really great things that you can use, not just for National Children's Dental Health Month, but throughout the year. We have them organized by age group and some, printable materials, infographics, activities, and games. There's also the Children's Dental Health Month section that has all of the new ADA materials posted in there as well. So that's a great space to, do one-stop shopping. Some of them are also bilingual in English and in Spanish. The other one that I want to point you to is our research materials. You can just type in the search box, social media, enter submit, and out pops a bunch of really great stuff that we already have on here. And just in a second, I'm going to post all these links into the chat so you have access to them. But there's, lots and lots of different libraries and toolkits here. The one big one that I want to point out that was made last year by Children Now is this COA social media toolkit, which you can also access through the COA webpage. So I'm going to go there real quick. This is our program, School Oral Health Programs in COA, and this link right here, the COA toolkit. This has all kinds of great things in here, like template slide presentations, talking points, template letters. And then if you scroll down just a little bit, here right there is that COA social media posting toolkit. So those are all the things that we currently have on our site. Matt will talk a little bit more about what we're working on to support you for February. But I think I'm going to stop there and turn it over to the team at Smile California, who will share their resources with us. So Smile California, as most of you know, is the Medi-Cal Dental Programs campaign to help more than 15.7 million members increase utilization of their dental benefits, and increase provider participation in the program. Campaign activities are designed to increase overall program awareness by educating members, encouraging trusted community level partners to play an active role in member education, and increasing access to Medi-Cal dental providers by encouraging provider participation in the program. So on behalf of Smile California, I'd like to invite Elizabeth Navarro to present with the support of Maria Mansour and Salvador Cruz and Lauren Lamplight. Go ahead.
Thank you, Aubrey. Hello, everyone, and thank you for joining us today. The purpose of our short presentation is to familiarize you with Smile California and the many messages, tools, and resources that you can leverage to help raise awareness of the importance of regular dental checkups for your own National Children's Dental Health Month efforts in February and throughout the rest of the year. For some of you, this may be the first time learning about Smile California, while we know others have been big supporters for some time now. Whatever your level of familiarity with the campaign, we welcome you and are excited to have this opportunity to share our materials with you and hope you will find them useful for your existing efforts. As you know, the dental health is an important part of the overall health. This is a particular significant correlation in the health of a child because healthy teeth not only help children eat, speak, and sleep, but better ensuring a child is not distracted by tooth pain helps them perform better in school. We hope that by the end of today's presentation, you will have a better understanding of Smile California and its available resources, both for members and partners. We also hope that you will feel well equipped to promote the importance of regular dental checkups with families in your communities, as well as connect them with Medi-Cal dental providers in the area. And lastly, we hope that you will feel motivated to utilize some, if not all, of our resources about oral health and school readiness and the Medi-Cal Dental Program campaign. Now let's get started. First, let's talk about the reason that we are here today, National Children's Dental Health Month. This month-long National Health Observance is intended to bring together dedicated dental professionals, healthcare providers, and educators to promote the benefits of good oral health to children and adults, caregivers, teachers, and others. National Children's Dental Health Month is a period in time for us to join together with unified messages to remind families and establishing good dental care habits at home at a young age is important. However, it is crucial for parents and caregivers to know that home care alone is not a substitute for dental checkups. Having a dental home and seeing a dentist every 6 months is the best way to ensure a child remains pain-free and able to focus in school. As mentioned earlier, although preventable, tooth decay is the most common childhood disease. For oral health, especially pain can affect a child's attendance, grades, and overall performance in school. In California, 1 in 5 kids experience untreated tooth decay, the leading cause of school absenteeism. As a matter of fact, in 2018, more than 440,000 K-12 students in California missed school due to dental problems. Aside from the obvious health benefits to having a healthy smile, a child's oral health can not only contribute to their confidence and how they feel about themselves, but having a pain-free mouth also makes them more prepared to thrive in school. What many parents and guardians don't realize is that brushing twice a day and flossing daily are important, but that is not enough. Children must also visit the dentist 2 times a year for a regular checkup, as dentists and hygienists check for oral health problems that might not be noticeable and can help catch problems early on or avoid them if possible. For those of you who may not be familiar with Smile California, we are the Medi-Cal Dental campaign that educates and empowers members with culturally and linguistically appropriate information about the importance of good dental care habits and how to go about finding a dentist within the network of thousands of Medi-Cal dental providers. Our member education includes addressing known barriers, such as not having a dental home, members not being aware of what their benefits cover, lack of awareness of the connection between oral and overall health, as well as being afraid and having anxiety about going to the dentist. Overall, our 4 primary campaign objectives are informing members of the Medi-Cal dental services available, increasing provider participation in the Medi-Cal dental program, enhancing dental care access in underserved communities, and increasing annual preventative dental visits. As many of you are aware, with the Medi-Cal dental program provides free or low-cost dental benefits to children and adults covered by Medi-Cal. Members under the age of 21 get 2 checkups per year and sometimes more. Members age 21 and older get 1 checkup per year. Covered services include exam x-rays, teeth cleanings, molar sealants, fluoride treatments, emergency services, tooth extractions, fillings, root canal treatments, crowns, scaling and root planing, periodontal maintenance, complete and partial dentures, and orthodontics for children who qualify. Next, I will walk you through the resources and materials we have available to support you in your oral health education efforts. The backbone of the campaign is the smilecalifornia.org website, a user-friendly gateway to the more in-depth features that the DHCS website offers. The website is available in English and Spanish, fully ADA compliant, and was truly designed keeping the Medi-Cal member and organizations who are on the front line interacting with members in mind. It is our central hub to provide information to members and partners about covered services, oral health tips, and offers a variety of downloadable resources. We also have a landing page available in 17 additional languages, accessible by clicking on the globe icon at the top of the website. And most importantly, the website helps connect members to care through the Find a Dentist button featured throughout the site for members to easily locate Medi-Cal dentists in their area. There are also a number of resources available for download on the website, including the Medi-Cal Dental Member Handbook, brochures, and flyers detailing covered services, educational one-sheets featuring oral health tips for members and their families, and fun activities to help teach children about the importance of maintaining a good oral health. Our materials are engaging and easy to understand, as our goal is to remove any mystery around dental cover so members can fully take advantage of their services available. For example, displayed at the top left, we have our photonovela series, which are essentially illustrated educational stories that feature topics such as scheduling baby's first dental visit, taking children to get molar sealants, and the importance of setting clean oral health routines for the whole family. All of our materials are print ready and available for you to both download and add them to your websites. Smile California has developed almost 20 animated videos on topics such as available Medi-Cal dental benefits, information about molar sealants, the importance and safety of visiting the dentist while pregnant, healthy dental tips for kids, and advice for setting clean oral health routines. You can find these embeddable YouTube videos under the videos page located in the navigator bar at the top of the site. In case you'd like to upload them directly to your site instead, you can directly download them from the links under the Videos subtab in the Partners and Providers section of the website. Smile California offers county agencies and nonprofits the opportunity to co-brand most of our materials. What this means is that you can include your program's logo next to the Smile California and Medi-Cal dental logos. To submit your co-branding request, you will fill out an electronic form, which you can locate in the Partners and Providers page. This is easily accessible by going to the smilecalifornia.org/co-brand. Once the request is received and submitted for state approval, a Smile California outreach representative will reach out to you and let you know if you have been approved. Please allow up to 4 weeks for delivery of co-branded materials. We also have dedicated outreach team with coverage throughout the state that can provide one-on-one assistance to your local oral health program for outreach events and materials. Their contact information is shown here on the map. Our Smile California representatives are here to help. Whether you need answers, event support, presentations, or tabling opportunities, we've got you covered. We invite you to save the date for our upcoming webinar on January 23rd from 11 a.m. to 12 p.m. as we kick off Smile California's 2024 National Children's Mental Health Month promotion and debut our newest materials. The Zoom registration link will be shared in the chat shortly for your convenience. Additionally, it will be sent out to our Smile Alert subscribers. We also ask COHTAC to share it with all of you. Keep an eye out for more details in the next couple of weeks. We also invite you to stay connected with us by following us on Instagram and Facebook. You can also email us with any questions, requests, or feedback you might have after the presentation through our hello@smilecalifornia.org email address. We also encourage you, if you haven't already, to sign up for our Smile Alerts to stay up to date with the latest Smile California news. To get on the list, visit the Partners and Providers page on smilecalifornia.org and fill out the Sign Up for Smile Alerts form. Any questions from anyone before moving on? Okay, well, thank you so much for listening in. I will go ahead and pass it over to Abby.
Yep, thank you. Yeah, I'll take it from here. Thank you so much, Elizabeth, and the entire Smile California team for being here and for presenting what you're working on. We will definitely put that event on our site and we'll add it as follow-up to this webinar. So next, I'd like to introduce today's main presenter. Matt Jacob is a communications consultant who advises oral health organizations, children's advocates, and foundations. He currently consults with a variety of stakeholders, including the American Academy of Pediatrics and the American Fluoridation Society. Matt has authored several articles about health communication or policy that have been published in peer-reviewed journals, and he lives in Arlington, Virginia. Matt, the floor is yours.
Thank you, Aubrey, and appreciate the invitation and the opportunity to talk with you all. So let me get right to our objectives. Let me see here. I don't know what it is lately. Sure enough, we're having problems advancing slides. So let me try this again. Not sure if this... Let's try here. Okay. All right, there we go. What do you know? All right. So I'm going to talk about 8 ingredients that I think are really key in planning and then carrying out an effective social media event. We are going to, talk a little bit about hashtags and graphics and that importance. And then I'm going to wrap up by talking about a different type of media. We hear a lot about social media, but there's always traditional media. So there are newspapers, there are radio stations, there's TV, there are bloggers, there are a variety of online websites that are carrying and transmitting news in your communities. And I want to be mindful of that as well. And both Aubrey and Kristen felt that that would be important to touch on. So we'll wrap up by talking about traditional media. So social media events, I think, are really important and as a way to build partnerships. They obviously can strengthen existing connections, but I think they also can lay groundwork to identify future partners and allies out there, people who you may kind of vaguely know about, but you may not have really had an opportunity to engage with yet. And, I think that when you participate in some way in an event like Children's Dental Health Month, what I found from a personal experience, from my clients' experience, is that you get an uptick in followers, you get some nice engagement. There are people who maybe weren't aware of you, weren't sure that you were active on this particular issue or something else, who suddenly gain some exposure and suddenly you're kind of on their radar screen, and that can be a positive thing. I also think it's important to, even beyond February, I want to encourage all of you to think about the platforms that you may be on. I think it's always helpful once or twice a year to just step back and do an evaluation, kind of a little self-assessment. What do we think we're getting out of these different platforms? And the reason I mention that is I know that those of you who are on this call, I know there was a pre-webinar survey that was done. There's a lot of engagement, a lot of activity on Facebook, on Instagram, platforms like that. Very low engagement on LinkedIn. And I think I can probably guess part of the reason why. It's probably why until about 2 years ago, I did almost nothing on LinkedIn. And that was, I think in the 90s and the early aughts, I kind of viewed LinkedIn as a site where you just upload your resume and, oh, isn't that cute, right? Here's my resume. It's online. If someone wants to find it, okay, done. And people would, sort of endorse you for this or endorse you for that. I didn't really see the relevance. But LinkedIn really in the last few years has started, I think, to become a much more valuable web platform for social media because the participants tend to be more individuals as opposed to organizations. So if you direct message somebody on X or on Facebook, you may be reaching their comms person, but you're probably not, in most cases, reaching the executive director or their director of policy or, a senior level person. On LinkedIn, you have an avenue to reach those people. And those people are in many cases going to be the key people who kind of decide in terms of priorities whether they engage in the field of oral health and they play a role there. So I just encourage you to take a look and consider the opportunities there. So February, it's not that far away at all, as you all can imagine. And so thinking about preparing for this, I think with any social media event, an observance or campaign, there are 8 key ingredients. Okay, you've already identified the first, which is, okay, what's the topic? What's the theme? And that's Children's Dental Health Month. I encourage you to pick a day or a week when you want everyone to participate. So I understand the argument. People will say, well, gosh, it's a whole month. Then why not just kind of let people decide what time in February, what day they're going to happen to post something or not post something? So that may be good for flexibility. The problem is we all tend to focus on deadlines, and deadlines tell us something is important. It has a sense of urgency. So I think if you give people a day or even a week and say, hey, the week of, February, the work week of February 7th through 11th, like that's the week we're going to encourage everybody to be active and post stuff, et cetera, et cetera. So I really think it just kind of shines a light on it and makes it just a little more, I think, meaningful. So, I also think that when you all are engaged and active on the same day or the same week, it really it demonstrates what collective action is all about, right? The power to move an agenda, the power to shape perceptions and put oral health more on at the top of people's priorities. So it also builds camaraderie, and I think that's important. So hashtags, I think many of you know what these are, but the nice thing is, especially during a monthly or weekly observance, they are important because people will occasionally go at the top of their page, whether it's Facebook, whether it's X, whether it's Instagram, and kind of go, hey, I wonder, like, what's the conversation here? Is anybody talking about this? What's been posted recently? This is a good identifier. It's a way for people who kind of want to get back into the conversation or into it in the first place to find it, right? And who's talking about it. So, when you do get messages that COHTAC and I know the Office of Oral Health are kind of collaborating on, make sure, don't sort of look at the hashtag and go, well, gosh, I don't need that, no, that's a very important part of the message. And so you definitely want to keep that in there. It's a great way not only to let people monitor what's being said, what's being talked about, what resources are being shared in real time. It also will help you all collect some metrics at the end of February that help you understand, what kind of impact you had, how many people participated. So there are a whole lot of different hashtag examples. Smile California has a very prominent, impressive footprint on social media. the American Dental Association usually promotes NCDHM, right? The abbreviations for National Children's Dental Health Month, for obvious reasons. But, there's also a hashtag that you all will want to settle on for this event so that you really can get a sense of California level participation and what kind of network you've built out, right? So definitely want to encourage that. So you definitely want to reflect your theme, keep it pretty short, shouldn't be too complicated, and then you're on your way. And the other thing, I guess, I don't think this is going to be much of an issue in this instance, but it's always good just to take one quick check and make sure someone else out there hasn't already been using that hashtag, that it hasn't really been picked up a lot, right? We don't want to use a hashtag that someone else may have been using last year or currently. So I don't think that's going to be an issue, but it's always good to double check. So the next step is deciding what your ask is, right? We are all very busy people. And if somebody sends a 4 or 5 paragraph email talking about some sort of social media event and the key, what, when, how, don't jump to the top. If it's hard to follow, if it's long, windy, sentences, people are going to kind of tune out and scroll and delete and move on, right? So making it as clear and concise what you're asking people to do, when you're asking them to do it, is very, very important. And I just posted the Golden State Warriors hashtag just to make sure all of you were still awake. And the social media campaigns, the events that we want to kind of be more present in and look to not only just in February, but really try and make this maybe a platform, a field in which the COHTAC network is much more visible. It certainly has helped when you have sample messages that you can share. And so, I know there's been discussion among COHTAC and the Office of Oral Health of trying to develop some sample messages, not a ton, but, even having just 10, 15 messages that you can offer to people, because we have to remember, right, there are some people who that nonprofit may have 1.5 FTEs, right? They don't have a full-time comms person. They don't have the luxury of having a person who only focuses on communications or even a person who focuses only on social media. So in some cases, you're asking people to kind of stop from their busy day and post stuff. So there are many groups out there that will really appreciate having something they can copy and paste in their Facebook window, right? Or X, or, whatever they're using. So, this is why this is very helpful. Obviously organizations with more bandwidth, they're probably going to write their own content. They may take some of this content and might tweak it a little. But this is a good way to make sure that nonprofits and other stakeholders that lack capacity can participate. And then speaking of participants, right, you want to recruit them. You want to think about who you can send an email to and say, hey, February's Children's Dental Health Month. This is the #1 chronic disease of children and teens. And, we really want to raise awareness. Please help us, right? So I think that I would not discourage communications people from talking to other communications people in their networks, but I really think it's important for senior people, leaders of these local oral health programs, right, that are part of COHTAC, to have that person send an email out to their peers at these other organizations and invite them, right? When it comes from the president, when it comes from the executive director, when it comes from the director of policy, right? That kind of thing. It's going to tend to get a little more attention, and it's also going to kind of be seen a little more as kind of, oh wow, great. They know we are out here. They appreciate our presence, and they're asking us to get involved. So it has almost a kind of appreciative element to it. Then I think one of the things I really encourage you all to do, and I know that most of the people in your network can't readily do this, but I know that there are some people in your great state who have the ability to create graphics. This one was created in Canva. Many of you are familiar with that software. It really is it's something that is not super difficult to use. These were created for this September event that the Association of State and Territorial Dental Directors co-sponsored, which was to raise awareness about oral health for older adults. So, we had a graphic like this. And this was just kind of right in addition to the emails on your social media platforms for a week or two in advance of February. You want to kind of begin to let people know, hey, this is coming up. We're going to have this week where we're building awareness. Please join us. It's a nice way because words get a certain degree of attention, but videos, graphics, other digital content get a lot more. And this is something you see a lot, right? So the U.S. Water Alliance, they have this event, I think for the past 3 years now, they've been promoting called Imagine a Day Without Water, and they do it in October. So, they have certain graphics that they post and just to kind of, again, build awareness, kind of establish their brand and so forth. The American Dental Association, the day after Halloween every year is National Brush Day. And so they create these clever little graphics, right? The one at the bottom is what they tend to show on the day of, and the one at the top is kind of what they show more because it's Halloween themed the last week of October to begin to kind of build that awareness. So these are the kinds of graphics that really are helpful in just kind of putting you on the radar screen. And it doesn't even take special graphics, right? The National Association of School Nurses does a World Hand Hygiene Day every year. And it's just kind of, right, the simple point of like, hey, wash your hands, it's going to help you avoid sickness and keep you healthy. And they had this cute photo of a student who had just washed her hands, got them all soapy. And it's just, again, thinking of the visuals because visuals are really powerful. In Southern California, the Children's Partnership, they've been running this campaign to raise awareness about how many children have been dropped either because of eligibility reasons or in many cases totally by mistake because of paperwork errors from state Medicaid enrollment. So, they're raising awareness, and this whole Keep Kids Covered thing is kind of they have graphics like this that are just kind of helping them keep this top of mind. So you can see the value of these things. So when we did the September event, right, we even had graphics for the day of. So right before we were ready to start posting content, we posted this graphic and, obviously a dose of levity here. I think it's any way you can kind of keep it fun and not make it so super, super serious is always kind of helpful. And then, and you'll notice the hashtag, right? Even though you've told people, even though the sample messages each has the hashtag in it, it's just one more way to remind people, hey, this is the hashtag we're using. Be sure it's included. So you kind of an all-in-one thing with that graphic. And then even afterwards, we did a little thank you message. So, good visuals really can help before, during, and after. And then last but not least, look for someone within your network to collect metrics after the event. And so this can be done in a number of ways. A lot of people have different types of software they may access. Larger nonprofits usually have an account. It may be a Hootsuite account, but I don't want to just promote that brand. It's, that's only one of several applications that do provide social media management. And one of the things they're good at doing is they can find out for you, for example, on Facebook, how many different unique users posted on the week of February blank to blank, right? How many impressions did they create, right? How much engagement did they get? How many people liked or shared or commented on it? So those are kind of helpful things just to give you a sense of the footprint you left behind and maybe give you something to aim for future events. So anyway, just you check. I bet you somebody within your network, if not several people, can offer to do these kinds of running to get these analytics. Running a quick readout does not take long at all. It's like a 10-minute exercise. So let's talk a little bit about the kit of messages that you're going to create, which is really going to be such a facilitator for smaller groups, individuals who are super busy, who really don't have somebody who can just take this on. Just want to give you a few tips. And so one of the things going to happen, just to kind of make this easy, is, I was talking with Aubrey earlier this month. So COHTAC can create a web page where the toolkit will sit, where it's going to be easily accessible. And again, it will reiterate what are the instructions, when is this happening in February, what are the people being asked to do, and it will include some messages. At least 10 to 15, I think, would be good. If you can get 20, that's great, but I don't think you need to go crazy. Just, having a dozen or so is just kind of a nice way for people who don't have the time to stop and think of the messages they want to send. And you've got good content about COA, so making sure that several of those messages kind of promote the kindergarten oral health assessment is just another great way to raise awareness for parents and caregivers. I think it's also good to consider having some graphics on that page that people can download and attach to their posts. So, the beauty of this is then COHTAC has a URL that can be sent to anybody, anywhere. Hey, this is one-stop shopping. Go to this site. It's going to tell you what the event is, what we're planning to do. It's going to give you some sample messages or even some cool graphics on there. So you're just making it so easy for people. Okay, so how do I write messages? Yeah, we've written some messages. We don't do social media a lot. So just a few thoughts I want to give you that I think can be helpful. So first and foremost, we know that what tends to go viral is stuff that shocked or surprised people. And so that's why I say tell them something they don't know or they may not know. Some people in your orbit know this kind of thing, but here's an example the Minnesota State Oral Health Director posted. So, there are a lot of people, if you are privileged, if you are growing up on a certain part of town in a certain zip code, dental disease may seem invisible to you. You may assume, oh, well, people really don't get cavities anymore, do they? So we really, first and foremost, need to make sure people understand how prevalent it is among children and teens. And so that's a good way to do that. There are a lot of people, I got to say, years ago, when I first really stepped into this field, I felt really dumb because I didn't know it was the most common chronic disease of children. I probably wouldn't have even placed it in the top 5. And I suspect there are others out there who don't know that either. So here's a situation where bad news can almost be good news because it might inspire, it might energize people and kind of go, what? Holy crap, I didn't know this, So you've got some great stats. Some of this research even comes directly from California. So that's even more cool. So definitely, look for ways to do that, to tell some people something they didn't necessarily know. And I think the other thing, though, is then you want to quickly pivot. You don't want all your messages to be the sky's falling down. Oh, gosh, things are really terrible. Lots of children have decay. They have toothaches. Right. We want to pivot and make sure people understand this is a solvable problem, right? The kind of work that Smile California is doing is part of the solution. COA is part of the solution. These are concrete strategies. They don't cost a ton of money. We just need to raise awareness. Let's make sure parents and caregivers know about these things. Because if people kind of look at something and they say, well, gosh, that just seems like an insurmountable problem, they kind of tend to tune out, right? We don't want that to happen. Being concise, always, always helpful, right? This was the best performing tweet that ASTDD posted in 2022, and it's like, what, 7 words, right? But an interesting graphic helps. And it just kind of, sometimes it doesn't take a lot to convey a really powerful point. So, definitely think about keeping messages as concise as you can. Even on LinkedIn, right? LinkedIn, those of you who do have a presence on there, you may be aware the limits on characters are like very big. You can write like 7, 8, 9 paragraphs of text in there if you want to. But even on LinkedIn, they do not display the entire message at once. They let you have 14, 15, 16 words or so, and then it says see more, and you have to click there. So even on a platform like this, that, the first 15 words are pivotal. You want to make sure you've kind of nailed it. So instead of focusing on the who, I always recommend generally the what is going to be more interesting than the who. You can get to the who later on, but the first thing is, what's the problem? What's the challenge? What's the opportunity, right? So getting that what up front, I think, is just always good. And then sometimes, people are like, well, gosh, I just can't think of anything at the moment to write. And I've been posted a while. And I always say, look at what others are posting. There's probably something that you find interesting or provocative. You can always thank them. You can lift them up. You can elevate what they're doing. Thanking them, reiterating what's going on. Hey, this is great news. It's a win-win, right? Because it kind of puts you out there. At the same time, you are clearly elevating and reinforcing a point that someone else has made. So, right, they call it social media for a reason. So be social. And then just some final thoughts on social media. Children's Dental Health Month is a great time to be active. I think it's wonderful that you all are gearing up for this. And there are some others as well. But I want to put on your radar screen, I think the real opportunity of social media engagement to help you identify some other people who care, who could step into this arena, who could partner with you, and it could help your voice grow even louder, are these kinds of events, right? So there is an oral health component to every single one of these events. And this doesn't even begin to name them all. So whether it's American Diabetes Month, right, we know the connection between periodontal disease and diabetes and vice versa. Obviously, National Nutrition Month, that's a big thing. I know you can't dive in every single month, right? There's just a bandwidth issue. But I encourage you, do take a look at some of these events that are coming up. And, they really are a way to demonstrate something that's so important, which is that oral health is connected to everything, right? And so, I think it just gives you that opportunity. And if you step into some of these issues, you're more likely to have people from the diabetes prevention community, the rural health community, right? Nutritionalists and dietetic issues, and oral cancer advocates and people who are in women's health, right? All of these different categories who suddenly you're making them think for at least a few moments about oral health. And, maybe they share what you've just posted. So let's pivot now and talk a little bit about traditional media, right? I think it's exciting what you all are talking about, the groundwork you're laying for social media engagement in February, but it's also a great time to reach out to the traditional media. And this starts with a pitch email. That's just the best way to do this. If you have a personal relationship with a newspaper reporter, like you know them well, they know you well, maybe you have been texting with them, cool, that's fine. I'm not asking you to reinvent the wheel, but in most cases, we don't necessarily know these people or know them well enough. There's a decent amount of turnover in the media. And so, I think it's just good to reach out this way. You want that email not to be super long, and you want it to be very focused. So we're going to talk about that in a moment. But I really think, there's a tendency to say, oh, hey, I've got an Excel file and my spreadsheet. I'll just copy all those emails. I'll dump them in my BCC of my email, and then I'll just send them all the same message and hit enter, and boom, it goes, right? I really discourage that because I think, each journalist, each blogger out there, they have a different perspective. They work at a different type of media outlet, and one size does not fit all. So I would also encourage you don't want to build your message solely around Children's Dental Health Month. Some people will consider that a nice bonus. Oh, okay, that's kind of something I can mention in the article or the blog, but that's not going to really by itself get them to write. So just, be mindful of that, right? What is the news? What else can you say? So I would focus on quality over quantity, look at, are there 3, 4, 5, media outlets where I think I could really get some traction? Generally speaking, here are some that I would recommend to you. So NPR affiliated stations, a lot of them, not only the news side, but many of them have some kind of public affairs programming, different programs, some on the weekends, some weekdays, some weeknights. Definitely want to be mindful of that. And, I think that just the profile of NPR, the fact that they tend to be drawn to this kind of area, and they definitely have been paying a lot of attention on health equity issues. So, you have an opportunity with the public affairs shows to really go deep And so I think this makes this a really good opportunity for you. Most NPR stations, not all, but many of them will actually give you, if you go to their website, a program schedule. What do they air? It will kind of give you an understanding whether they have bilingual programming. Do they have Spanish language stuff that they have as well? So just definitely take some time and check that out. Daily or weekly newspapers, also very good places to consider, for your outreach. And I would say there's a couple options here. So the first option would be you write a pitch email to a reporter saying, hey, here's what's going on. This I think would make a good news story, and I could connect you with people who are, people who are working in this field, maybe a clinic manager, maybe a dentist, maybe a parent advocate, et cetera. The easier you make it to cover the story, the more likely they are to cover it, right? And I'll show you why in just a moment, okay? So let's see. All right. Okay. I am frozen. Let me see if I can restart this and get us back where we were. Sorry. Okay. Okay. Excellent. All right. Let's see. Well, all right. I have not had good luck lately with Zoom. I don't know what's in the universe right now, but okay. Let's try this one more time. See if this will work. Okay. I'm going to go down here. Okay. Let's try that. Okay, here we go. All right, so there is a second option. And the second option for newspapers is to look at doing a guest opinion column, right? Or maybe even a letter to the editor. But I think a guest opinion column is something to think about. Weekly newspapers might particularly appreciate that. They generally are running on a shoestring. So when people will provide content for them, they definitely are going to be receptive. Those columns are generally somewhere between 500 and 600 words. So keep that in mind. And then I wouldn't rule it out for TV. Now, here's the thing about TV. Morning TV is like a totally different universe than afternoon or evening TV. Morning shows tend to be very focused, a lot more, I think, on women and especially moms. And so it does make certain programming a little more like the news to use angle, right? That's very big in the morning. And depending on how big a TV marketplace your media market is, this might get some receptivity. So offering some dental tips, right? We know that it's been several years since the recommendations about how much toothpaste to use have gone out there, but a lot of people, program directors at TVs, they don't know that. A lot of parents still aren't aware of how much fluoride toothpaste you're supposed to use based on age, right? There are tips you could give, but first and foremost, you might talk about, hey, we are revving up to really expand and get more parents aware of the kindergarten oral health assessment that we want their children to have. Make sure they're healthy. I'd love to come on your program and talk about it. So that's a real good opportunity. And then, please think about alternate language media, Spanish and others. I mean, these are key subgroups that you want to reach. I know that. And so, don't overlook them and think that they're going to be reached through other traditional media. This is just an example of, what I'm talking about. So, this is about as long an email as you'd want, but you notice how if you have some bold-faced headers, kind of some kickers, it makes it a little easier to get through this. So you tell people, what's new, right? They call it news in part because it's something that is new. So, what is new, right? So make that clear. What's the local angle, right? TV stations, if you're in San Diego County, they're just going to care a lot less about what's happening in other counties than they are what's happening in San Diego County. If you're in Amador County, same thing, right? So no matter what part of the state you're in, local angles are just key, right? And just providing some information about it. So why does it matter? It doesn't hurt to even just put that phrase in, right? Why it matters. Again, don't assume they know how common tooth decay is. right? Don't bombard them with stats, but have a few key stats. That's good. Then the key is, all right, okay, I'm kind of interested in this. So, well, what are you offering? Who would appear on this morning show? And so you might mention, okay, here's an expert guest who could appear. This is who she is. This is what she could talk about. Blah blah blah. So getting that out there. So this story appeared several years ago in the Fresno Bee, right? So even though there were lots of facts in this story, the reporter wanted to highlight a particular woman who was having issues with her oral health, could not afford dental care. So reporters and media always want to put a face on an issue. So if it's really important, if you want people to write a story, air a story, to have some people in mind that you can refer them to. If you have a dentist, an FQHC clinic manager, others who might be able to refer them to somebody, it's just good. It's good to know, because if they feel like they're going to have to scramble from square one to find these people, they might be less likely to do that story. Be careful about your abbreviations and clinical terms, right? We don't want to talk about caries, it's cavities, and at most tooth decay. That's as complicated as you want to get. You're used to COA, you know what it means, but remember, you're going to want to spell that out the first time you use it in a press release or a pitch email, because not everybody wakes up in the morning and thinks about COA. So look at your media lists. If you don't have a media list, this is a good time just to kind of think about your community, newspapers that are there, any prominent blogs or web pages, TV. Definitely want to think about who should be in there. And this is not about having a huge media list, right? It's much better, again, to have quality rather than quantity. So just double checking contact info and all that before February is important. So that's what I've got for you. I'm certainly able and willing to take any questions or comments that you might have. I hope you've learned from me. Any comments you have, I welcome the opportunity to learn more from you. And so, this is kind of what we're going to be transitioning to, some breakout groups. And I'm going to let Aubrey kind of step in here, and I'm going to stop sharing, if that makes sense. And Aubrey, I'll let you take it from here, but I'm certainly open for any questions people might have.
Thank you so much, Matt. That was a terrific overview and super rich. Just so everyone knows, we will be posting slides and the recordings. You'll have access to those afterwards. And we do have one question in the chat now. And if you have more questions, feel free to put them in the chat or raise your hand and we can unmute and chat. But the first one is there a way to track analytics for when other organizations or partners post or use our hashtag on social media?
Yes, there is. That's another great reason why hashtags are so important. So even if they're not part of the COHTAC network, even if they're not a grantee from CDPH, as long as they use that hashtag in any message they post, you will be able to find it. It will be identified on that platform if you use one of these, apps that does that kind of searching for you. So I think that's the beauty of it, right? Like in September when we did that event for Healthy Aging Month, it was really cool to be able to find all of these, the Vermont Council on Aging posted about oral health, right? That's not normally what they focus on, but the searchability of that hashtag is really cool because it lets you see just how far out of the oral health bubble you were able to reach.
Yeah, thank you. And speaking of hashtags, we have come up with a few ideas for a California specific hashtag. So I'm going to launch this poll, which should be popping up on your screens now, with a couple of ideas that we have worked on that we could use for a California specific National Children's Dental Health Month hashtag. And I believe you can select all that you like, but the more selective you are, the more likely we might find one that will work for everybody. So I'll give you a chance to take a look at those and see if any of them feel good to you, and maybe we'll come out of here with a winner. But if you are feeling creative and there's something that's not on this list that you would propose, also feel free to drop that in the chat box. And like Matt said, our team will be working on creating that page with the toolkit so there will be one URL with a handful of messages ready to go for folks to share with your partners. And that will be coming out in January. Okay, so I'm going to go ahead and end the poll and then I will share it so we can all see. All right, looks like more than half of you like the hashtag healthy teeth for California kids. So maybe we have found our winner, which is great. And if there are any other comments on the California specific hashtag, feel free to add those in the chat or again, unmute yourselves and we can chat. Are there any other questions for Matt before we go into some breakout rooms? One just came in. What's the rule of thumb for how many hashtags to use in a single post?
Yeah, so I guess I have a few thoughts on that. So in general, on Facebook is not the kind of platform that really encourages a lot of hashtags. You'll see some here and there. I would say the typical message might have one when it's sent by like a nonprofit or organization, maybe two at the most. X, otherwise known as Twitter, has tended to be a little more hashtag friendly. And then, of course, you get to Instagram, which is like, we've got 25 hashtags at the bottom of this message, right? So that's another reflection of how culture varies significantly. But I think that the one thing I have said in a discussion I had with someone about this was, if you want to designate a hashtag for people to use, I would recommend saying to them, hey, here is the hashtag we're asking everybody to use, with the understanding that they might also choose to hashtag the term health equity in their message, which is cool. But like for the campaign and to gather your analytics, I would suggest a single hashtag for them, recognizing that they might decide to add a second or a third hashtag potentially about health equity or child health or parents tips, right? That's a popular hashtag. So, but so that's kind of my take on it.
Okay, thank you. I'm not seeing any other questions right now, and don't think there are any hands raised. Oh, Golden State Smiles. That's a great one too.
You might anger some Lakers fans, but hey.
All right, excellent. Okay, well, if you have more questions for Matt, I think he's with us for the whole time. So feel free to continue to add those to the chat box. But for now, I'm going to go back to my screen and we are going to jump into some breakout rooms with discussion. So if Gustavo, if you could put the link to Mentimeter in the chat, what I'd like all of you to do is click on that link to join. This is where we're going to be collecting some of your responses from your discussion. And the instructions should be there as well. But we'd like you to do some brief introductions to get to know each other a little bit with your name, the LHP that you're from, or your organization, and one key takeaway you're taking from today's talk. And then we want you to think about who you're going to be planning on reaching out to on both social media and from traditional media. So is it going to be a specific newspaper in your area, or is it going to be your local school superintendent or a parents group or whatever that might be? I'd love to collect all of the responses that you have in your individual groups, and we will collect that into a word cloud and share it with you all afterwards. So I'm hopeful that we can create a really great list of groups across all of you who are going to be you are reaching out to for Children's Mental Health Month. And I'm seeing Deborah saying that the link was not working. Is that true for others as well, or are you all getting into Mentimeter? It's working for Monica. Okay, thank you. Okay, we'll work with you, Deborah, to make sure that you have access to that. But I'm going to go ahead and open all of the rooms so that you guys can have some time to discuss. And then we will meet you back here in about 10-ish minutes, and we'll take a look at what you guys talked about. Welcome back, everyone. You should see on my screen some of those responses that you shared. So I hope you guys had some fruitful discussions. I am seeing schools and parents as primary audience, which makes sense for Children's Mental Health Month, which is great. But I'm also seeing some really unique responses. So refugees, community libraries, let's see, coalitions, school banners, WIC. This is fabulous. I'm going to go ahead and move on to the next question to see what we got for traditional media. Yeah, newspapers, new mom groups. That's a good one. Breastfeed Alliance, local radio, FQHCs. Yeah, this is great. And we'll continue to collect your responses, and we will save them out with you afterwards. But I'm going to just stop sharing and allow you all to unmute yourselves if you want. If you have reactions to what you discussed, or if you want to share anything that unique that came out of your discussion, I'd love to hear some of it. Or Matt, if you have any reactions to what you saw, we'd love to hear from you as well.
Yeah, I think it sounds like everybody is thinking very expansively, which I think is really good. And it's I like that on traditional media outreach, people were not just saying newspapers or radio stations, but they were talking about community-based organizations, which is a really good thing to be aware of. I mean, we know that there are a lot of community-based organizations. I'm thinking of like Boys and Girls Clubs of America, United Way, who often will publish a newsletter of their own. And many of the times they're eager to find content, right? It's like, oh, I'm doing the monthly newsletter, gosh, I have some extra room. And so, when you have an opportunity to reach out to those people and even just supply them with, 2 or 3 paragraphs of information, in many cases, they might be willing to just take that and use it verbatim because they just appreciate knowing that you are aware of COA, you're aware of what's going on, you're aware of eligibility or new opportunities to make sure that people can attain dental services through Medicaid, et cetera. So definitely have those groups on your radar screens, because those internal newsletters may not reach a huge audience, but boy, they reach such an important audience.
Absolutely. I see Lori's hand is raised. Go ahead, Lori.
I was curious, you were mentioning that COHTAC would create a toolkit for February. Do we need to get approval to use what is provided in that before using it?
That is a great question. I'm wondering if someone from the Office of Oral Health can chime in.
I was curious because they said it could take a month to get approval, so I mean we need to do that now then.
Hello, this is Joanna. Could you please repeat that question?
Um, so if COHTAC creates a toolkit for the February event, do we need to get permission before using those resources in the media?
Oh, for the media. If it, that's a good question. Let's do it like this. You wouldn't have to go through the media review process that we've been doing because the timing is so short. And if you're using the messages as COHTAC designed them, then those will already be approved by OOH. But if you could please still alert the media team, Karen Jacoby and Stephen Starr, that's what you're doing. They follow the messages, they track that and the budget. So that would be the purpose of that, just alerting them that this is what you're doing. But the message itself, if it's coming from COHTAC, should be pre-approved. Does that make sense?
Yeah, and how do we alert the two people you just mentioned?
Email Karen Jacoby. I'll put it in the chat. Karen Jacoby and Stephen Starr. That'll be your media messaging, and they can track that and check on the budget. It's just to make sure that we're tracking those things.
Oh, excellent. Thank you.
I'll put both those emails.
One more thing. This is Roseanne. Even though it's approved by OH and developed by COHTAC, you probably still need to go through your communication at the local health jurisdiction to get approval. And you can put that as part of your cover email that it was developed by the California Oral Health Technical Assistance Center on behalf of the CDPH or Office of Oral Health to give it validity.
So do we need to email our oral health representative and let them know we're using it?
No, I think what Joanna just said was right. If you just, send that email to Karen and Stephen, that's fine. But I was just saying for your own internal purposes, you should go through your communication team or whatever approval process you have in your local health jurisdiction.
Okay, thank you.
Great question. Thanks, Joanna and Rosanna. Are there any other questions or reactions to the discussion? Okay. I'm gonna go back to my screen then. So we are going to start wrapping up. So I just wanted to promote a few upcoming events that are happening in the new year. We have our next COHTAC Share and Learn on January 18th, where the School Dental Programs Work Group is sharing some new resources that they've been working on. And as you heard today, Smile California is hosting a webinar about National Children's Dental Health Month on January 21st. I believe that's already on our site. Thank you, Gustavo. But we'll share that information with you again if you didn't receive it from the chat today. And then in February, which kicks off National Children's Dental Health Month, there'll be two more Office of Oral Health project directors meetings. So those are coming up. And I'm going to go ahead and launch our evaluation survey, which should be popping up on your screens now with a few questions to let us know what you thought about today's webinar. I'm also going to post a Qualtrics survey where you can send us any written comments. And I'm going to go ahead and wish you all very happy holidays. Our team at COHTAC will be off starting December 23rd through January 1st, but we'll be back online on January 2nd to support you. But we really appreciate you being here, and we hope you have a nice holiday break and a very happy and prosperous new year. I also want to thank a handful of LHPs who worked with us in designing the content for this webinar. So we really love hearing from you and hearing what you want and what you need. And so if you're interested in helping us, one, with that toolkit that we'll be working on to post to our site, that's one of the questions in our survey, so let us know. But two, in any other future surveys, we would, webinars, we would love your input so we can design something that's helpful and useful for you. And with that, I just want to thank the Smile California team who popped on here to show us what they have in the works and what's coming up. I want to thank Matt for spending time with us and sharing your insight and your wisdom. We thank all of you for being willing participants to jump into those the small groups and be open to discussing and trying something new this time. So I hope you enjoyed that. And happy holidays. Thank you so much for being here, and we will see you in 2024.